Hello, friends. Today we are having a very special session with Dr. Abi. He's a infectious disease physician, and he is also one of my close friends. And I know that he has received so many grants and awards, and he also has several publications in the field of infectious diseases. And we are going to discuss with him over a few days some of the hard questions and some of the doubts that we have related to COVID. And we are very grateful for him to be here. Hi, Abi. How are you?
Hi. Good.
So one of the questions that we often, all of us face is that, can we get reinfected with this coronavirus? I mean, once a person is infected with the virus, can he get the infection again? Because earlier it was believed that once we are infected, we tend to have a prolonged immunity over a period of time, either lifelong or at least for a few years. But there have been some little bit of panic among people that we can actually get reinfected with the virus. And what does the current evidence say?
It appears true that you could have a small chance of reinfection. The chance of reinfection is so small that if you look at the world cases of COVID today, you have more than 25 million cases, and we have only 8 probable reinfections in the world. Of them, 2 of them are little more convincing. So the number of reinfections are probably very, very small. So a small proportion of people may have a reinfection at what it looks like.
Okay, sure. So those reinfected cases, were they severe form of disease, or did they require ventilator support and things like that, or they were just mild cases?
That's a very interesting question. If you take infectious diseases per se, if you get a reinfection, as a general rule, your reinfection tends to be a little milder because you have immune response already to protect you from the infection, at least partially. If you look at these 8 cases, one of them had a COVID pneumonia requiring oxygenation, but most of them were rather mild. This patient I'm talking about, reported from Nevada in US, had a very close household contact, and probably the amount of infective material he was exposed to was probably quite high. That may explain why he came down with a pneumonia while others didn't. Generally, it looks like they might not have a very severe infection.
Okay, so that's a great news. So we are looking at a very small proportion of number. So we have so many millions of cases have been detected so far since last December, and in that, maybe if we compare the proportion, it will be like maybe 0.00001% or less than that. So who have been reinfected. So that's a really good news. I think that makes us really to think that we should not really get scared or frightened once we hear this word of reinfection, isn't it? Okay, so what are the practical implications? What are the practical implications of this whole concept of reinfection? So now that you are saying there is some evidence that there are a few cases have been reported with reinfection, so what does it tell us?
Mostly, I think things remain unchanged. And this was something sort of anticipated. There might be a small number of reinfections. So what it clearly changes is for the people who have already had COVID. So it looks like they can't relax after an episode of COVID infection. They should strictly adhere to personal protection measures like mask wearing, and if they're in social distancing in the right circumstances, all they should also clearly adhere to, because a small proportion of them may still have a risk of developing reinfection. So it looks like they need to be careful. Yeah.
Okay. So that's a great insight. And earlier, I think we used to think, okay, once I'm get infected, I'm going to be protective lifelong, and I can just go out without having mask, or I can just do all kind of things. But I think now we should be cautious and take all the precaution, even if you get one infected with the virus once. Okay. So does it mean that when I get infected with the virus, or say I get hospitalized today with the virus, the viral infection, when I go home or after a few days, should I repeat the test and see whether my antigen become negative or not? Is it really required?
Yeah, yeah, yeah. So currently, if you look at the government guidelines for COVID-19 in India, they clearly tell you that there is no need for an exit test when you get out of the hospital to swab and say somebody has cleared the virus. That's based on very good scientific evidence to say that the virus sticks around in the body for a few weeks to even few months in some people. So it looks like that doesn't change because of this thing of reinfection. We should adhere to that existing policy, and one need not to be proven negative before they go out of the hospital. So that doesn't change much. Yeah.
Okay. So it's not really required in the current setting.
No,
Okay.
no.
Okay. So what are the implications to the vaccine for this whole thing of reinfection? So earlier we used to think, okay, once I get the vaccine, okay, vaccine is a answer for all the problem that we have right now. And then once if I get vaccinated and I am protective lifelong or for many years, and that kind of a confidence that we had. But now we are saying that there is a possibility that a small proportion of people can get reinfected. So does it make the vaccine ineffective?
So we are probably a bit early in the vaccine part of COVID prevention, but we have got some very good candidates in the race for vaccines where studies are still ongoing. But it looks like overall the small rates of reinfection should not change much in the vaccine arena as well. We have also evolved many strategies to better vaccine responses like repeated vaccination and things like that used in diseases like if you take flu, for example. So those strategies can still be employed even if there is a small chance of reinfection.
Okay, so we can still have confidence on vaccine, and that can actually reduce the risk of infection. So we don't have to be really frightened when we hear the word reinfection, I guess. I think
Yeah, I think overall it changes very little. Yes.
okay. So thanks a lot, Abhi, and that clarifies a lot of our doubt regarding reinfection, and thanks for joining us today. Bye-bye.
Thank you for